Hi guys, welcome back to my YouTube channel. In today's video, we'll be addressing a serious question that many persons keep pondering about, which is, do I have HIV? It's a serious question that requires a sincere answer. In today's video, we'll be talking about HIV, the signs and the symptoms of this condition, how it is being transmitted, and what you should do as soon as you find out that you have HIV. I'm pharmacist Vera, and this YouTube channel is focused on health and health related talks. Please, if you've not yet subscribed to my channel, please do that. So now, what is HIV? The full meaning of HIV is human immunodeficiency. This virus attacks the CD4 cells in the body, which is also known as the T cells. It is these cells that signals other cells in the body when there's a foreign body. What HIV does is that it attacks these CD4 cells, yes, and continues to reduce the number of these CD4 cells while the HIV virus multiplies. Yes, so this is how the HIV virus acts when it enters the body. It attacks that CD4 cell. When this happens, immunity becomes low. There are several stages of this infection. In the first stage, usually 2 to 4 weeks, which is called the acute phase, it is accompanied by symptoms like flu, such as fever, cold, rash, and in this stage, it is highly contagious. It is very easy to transmit this virus to other persons. In this stage, there's a rapid multiplication of the virus. The second stage is the chronic phase. In this phase, there is no sign and there is no symptom, but there's still multiplication of this virus in there. So the person may not even know that there's something there, but there will be no sign. It will just be like there's nothing, you are okay. But the virus is rapidly multiplying. And if nothing is done, it will move to the last phase, which is a severe phase, which is acquired immunodeficiency syndrome. And if medications have not been taken all this while, this phase, the immune system of such person will be completely damaged and the person becomes completely vulnerable to opportunistic infections. Opportunistic infections are those infections that are able to enter the body when the immune system is low, when there is no protection for the body, the immune system have been damaged. That's when such infections enter the body. So now, how is HIV being transmitted? And unprotected intercourse. Unprotected intercourse is one major way that this virus can be transmitted. Two, the sharing of sharp objects. For persons that share razor blades, share shaving sticks, and other things, you are putting yourself at risk because you do not know the HIV status of the other person. And for healthcare professionals that work in the hospital, you have to be very careful when handling the syringes because it's also a sharp object. So sharing of sharp objects also a way that this virus can be transmitted. Number three is through childbirth or breastfeeding. That is the reason why whenever a woman goes to the hospital to register for antenatal, a number of screening will be done. Yeah, and even when she wants to put to birth, a number of screening will be done to be sure that this woman is not HIV positive so that preventive measures can be put in place. Number three is through blood transfusion or organ transplant. Before you transfuse blood in a hospital, carry out a number of tests to be sure that the blood is safe for transfusion. So you don't transfuse a blood that is already HIV positive to a person that is not HIV positive. So these are the major ways that the HIV virus can be transmitted. HIV cannot be transmitted through hugging and shaking of hands because most persons are scared. There's this societal stigmatization that comes with finding out that a person is HIV positive. You may be scared of hugging the person or shaking hands with the person. You cannot get the virus through shaking of hands and hugging. It is when you do these four things I've listed: unprotected intercourse, sharing of sharp objects, childbirth or breastfeeding, and through blood transfusion. These are the major ways that this virus can be transmitted. What are the preventive measures? How can you protect yourself from becoming HIV positive? How can you protect yourself? What measures can you put in place to ensure that you protect yourself from this virus? Number one is to use protection. Protection like condoms during sexual intercourse, especially with a person whose HIV status you do not know or you are not sure of. So you need to protect yourself by using condoms. Number two, the use of pre-exposure prophylaxis. For persons that are already at risk of getting this HIV virus, you need to be taking pre-exposure prophylaxis. It's a medication you need to take to protect yourself from the virus. Number three is the use of post-exposure prophylaxis. For persons that have been exposed, maybe you've had an unprotected sexual intercourse with a person that is HIV positive, or as a healthcare professional, the syringe of a HIV positive patient, you mistakenly used it on yourself or something, you will have to take the post-exposure prophylaxis medications. To protect yourself, you have to start taking it in less than 72 hours after being exposed. Last preventive measure is avoid sharing of sharp objects like needles, like syringes, like razor blades, like shaving sticks. Avoid sharing of sharp objects. This being said, I want you all to know that the symptoms of HIV may vary from person to person. Not all persons may present with the fever, the rash in the early stage of HIV. For some persons, it may be completely silent. There may be no symptom at all. You may not even know that something is wrong with you. Yes, that is why it is very important to check yourself from time to time. Also, be aware that detecting this virus early is very important for what? To optimize the health outcomes. If you detect this virus late, it may become difficult to really manage this condition. Yeah, other symptoms you may experience is rapid weight loss. Let's say you lose weight, an unexplained weight loss you can't account for, you feel fatigued. Yeah, and then there's fever and other skin condition, most especially fungal conditions and other bacteria skin conditions. These are pointers that okay, I'm okay, I was okay, and I'm just losing weight. Maybe I should check my HIV status. This skin infection, I've been trying to treat it, it's not going. It's fungal infection today, tomorrow it's a combined one, both fungal and bacterial infection, and it is not responding to medications. You have to treat yourself. You have to go and see your healthcare professional and carry out this test just to be on the safer side. This does not imply that having these symptoms automatically mean that you are HIV positive. You just have to test yourself to be on a safer side. This being said, for persons that have tested themselves and they are HIV positive, it is not a death sentence. Yeah. HIV is not a death sentence. All you need to do is to take your medications as you should, and you should try to protect your loved ones from too by not sharing your sharp objects with your loved ones or having sexual intercourse with your HIV negative partner without using protection. So it is very important we take note of this. It's not a death sentence. In as far as you can take your medications as you should daily, it is very important for your well-being. Kindly note that if you don't take your medications as you should, it will lead to an increase in your viral load. When your viral load increases, you are putting yourself at risk. Remember, the last phase is acquired immunodeficiency syndrome. A patient gets to this phase if the first two phases are not properly managed. Yes. So thank you very much, and I'm sure you have found this video helpful. Please share this video with your loved ones. Click on the subscription button if you've not subscribed to my channel, and like this video. Please feel free to ask questions in the comment section. Thank you.